So, what are cross addictions and what are co occurring addictions? You really very rarely see anybody with a pure addiction these days. I think 30 years ago, you might have seen an alcoholic or maybe a drug addict, but not so much of multiple addictive behaviors, multiple substances. And so we have a way of classifying what we're seeing now with multiple addictive behaviors. Two ways. One is cross addiction and one is co occurring addiction. And they're slightly different. Cross addiction is really kind of an alternating pattern. So you might have someone who is a sex addict, say sex and porn addict, and when they're not acting out sexually, they may be using alcohol to numb feelings, this is often a cycle, back and forth, to distance themselves, to manage those urges, and then, or ultimately to disinhibit, and then they go back on the sexual acting out and get into that behavior. Co-occurring behavior is more when they occur simultaneously. And so that would be what we call fused drug and sex behavior, or chemsex, where, for example, typically you might have someone who uses stimulants, cocaine and methamphetamine, and combines that with sexual behaviors to enhance the sexual experience. And so it's really a pattern of alternating or kind of simultaneously occurring. And there's different ways of doing that. There's alternating cycles, which is kind of switching back and forth the way I mentioned it. There's combining them. Sometimes this is because of tolerance, to add more to get that level of stimulation they're seeking. We kind of call that stacking behavior, where people combine things. We know that people will escalate as tolerance develops, so they may use new drugs. They may escalate the kind of mode they ingest the substance with. For example, moving from snorting or smoking to injecting. And there's all kinds of other things, even some patterns that you might not think about. So, for example, a lot of people who may be really good sexually, maybe they have a lot of shame about their sexual orientation or a particular fetish, may use substances to kind of numb that pain. It's not necessarily directly related to their acting out, but it's certainly connected to their ability to manage the emotions that they may be experiencing that are uncomfortable and negative around that emotion. So there's a number of different other things, but basically the important thing is the cross-addiction, cyclic pattern, and the co-occurring being simultaneous behaviors and substances used at the same time.
Thank you, David.